In this video, we'll be discussing tips every mom should know in dealing with fever in your child. Before we get started, please like this video, share it with another mom who needs to hear this, and subscribe to the channel for more honest, practical content about pregnancy, childbirth, and life after birth. Fever in babies is one of the most common reasons parents worry, yet it is also one of the most misunderstood symptoms in early childhood. A fever is not an illness on its own, but a sign that the body is responding to something, most often an infection. In babies and young infants, fever is generally defined as a body temperature of 100.4 degrees Fahrenheit or higher, especially when measured rectally, which is considered the most accurate method for infants. Babies can develop fever for several reasons, including viral infections such as the common cold or flu, bacterial infections, reactions following routine immunizations, or even due to overheating from too excessive clothing or a hot environment. Doctors emphasize that viral infections are by far the most common cause, and these usually resolve on their own with supportive care at home. Most fevers in otherwise healthy babies are mild and self-limiting, especially when the child remains alert, feeds well, and responds normally. Monitoring a baby's temperature correctly at home is essential for safe care. For infants under 3 months, rectal temperature measurement is recommended for accuracy, while forehead or temporal artery thermometers can be used in older infants. When caring for a baby with fever at home, comfort and hydration are key priorities. Fever can increase fluid loss, and babies may feed less when unwell, so frequent breastfeeding or formula feeding is important to prevent dehydration. Hydration supports circulation, temperature regulation, and recovery, even when appetite is reduced. Parents should offer feeds often and watch for signs such as fewer wet diapers or a dry mouth. Dressing a baby appropriately during fever is another important step. Babies should be dressed in light, breathable clothing, and heavy blankets or layers should be avoided, as they can trap heat and raise body temperature further. Maintaining a cool, well-ventilated room helps the baby's body regulate heat naturally. Experts advise against overbundling, as it does not reduce fever and may worsen discomfort. Some parents use lukewarm sponge baths to help lower a baby's temperature gently. This method can be effective when done correctly, but cold water, ice baths, or alcohol rubs should never be used, as they can cause shivering and raise the internal body temperature. The goal is comfort rather than forcing the temperature down quickly. Adequate rest is also essential, as sleep allows the immune system to function more efficiently during illness. Medications for fever should be used cautiously and only when appropriate. Acetaminophen, paracetamol, may be given to babies older than 2 to 3 months, provided the correct dose is calculated based on the baby's weight and a pediatrician's guidance is followed. Ibuprofen may be used in babies older than 6 months if recommended by a healthcare professional. Aspirin must never be given to babies due to the risk of Reye's syndrome, a rare but life-threatening condition. Although many fevers are mild, certain situations require immediate medical attention. Any fever in a baby younger than 3 months is considered an emergency and should be evaluated by a healthcare professional promptly. Other warning signs include difficulty breathing, seizures, extreme lethargy, persistent vomiting, stiff neck, or a rash that does not fade when pressed. Pediatric guidance emphasizes that fever lasting more than 24 to 48 hours in older infants or temperatures reaching 104 degrees Fahrenheit 40 degrees Celsius should also prompt medical review. Importantly, pediatric experts stress that the baby's overall behavior is often more important than the fever itself. A baby who is feeding, responsive, and intermittently playful is usually less concerning than one who appears weak, unresponsive, or unusually irritable, even if the temperature is similar. Pediatric associates highlight that fever is part of the immune response and does not automatically mean serious illness. Parental instinct also plays a crucial role in managing fever at home. Parents know their baby best, and if something feels wrong, it is always appropriate to seek medical advice, even if the fever seems mild. UNICEF encourages caregivers to trust their instincts and prioritize early evaluation when concerned, as timely care can prevent complications and provide reassurance.